question.
Thank you so much. We are here for our question and answer portion of our discussion. So happy to have live here Dr. Jacob and Dr. Montoya. And we also have Dr. Calloway available by Zoom. And we have some great questions that you guys have submitted. I wanted to go ahead and also encourage you while we're doing our question and answer to submit more questions. If you have anything else you'd like to know, we have some allotted time to answer any questions that you guys may have. So the first question for our panelists is there any specific questions that I can ask my child to determine if he or she is having trouble during meal times with swallowing? What kind of questions would you ask?
I'll take that one. I think that's a really great question, and it gets to the core of kind of how do we think about and diagnose eosinophilic esophagitis. And this is one of the things that I really focus on when I'm teaching medical students and residents and fellows in GI to really kind of take the time to ask the right questions and to ask questions that help you understand what is the risk of this patient in front of you having eosinophilic esophagitis. So,
can you add another question?
So one of the challenges with this question is the fact that when you think about it, you're eating a shorty. You don't have a reference for what other people feel like when they eat. And so it's challenging that everyone's
They said yeah because we had already asked them that question.
Oh, really?
So
Okay.
even if it's not
Because I was wondering, because the yolk is usually what's so bad, and egg beaters are made
so
out of egg
oftentimes you have
whites.
to ask the right questions to
We had
get
a certain
at,
time we
you know,
bought
are
it
you
so
experiencing
right,
things that we would
mine
recognize
can
as
fall
abnormal,
apart.
even though you feel like this is normal because you've never felt any other way. And in medical school, we often learn also it's helpful to start with
I think if it
kind of
has any
broad,
parts of the egg, you
generic
can't use it.
questions
Oh, really?
and narrow down on focused and specific questions later. In that if you ask too many focused questions early on, you can lead people to answer yes and bias their answers away. And so it took me a long time to kind of figure this out and how to ask a more general question. And so generally, if you see me in clinic the first time and I'm starting to wonder if you have eosinophilic esophagitis, one of the first questions I'll ask is, do you have trouble eating? And in asking that, do you have trouble eating, I oftentimes get the answer no. And again, because your eating is normal. But there are people that the kind of body language and the pause sometimes is revealing that oftentimes the kids and families with eosinophilic esophagitis kind of have to think about it a little bit versus the reflexive no. And when I hear that pause, when I see that body language that tells me, hey, they're thinking about it, I ask them to explore that. And so, they'll oftentimes say, oh, well, I don't have any trouble, but, I kind of, I'm a little bit picky and, I don't really like to eat certain foods. And so you can start to explore further. And I know, because of treating a lot of patients with this and from the literature, that picky eating is one of the cardinal features. It can be a very common thing in school-age kids as well. But, if you're picky and you're picky specifically against things like meats or breads or rice and pasta, those are red flags for me. Hey, that could be eosinophilic esophagitis, especially in a school-age kid. Other features around eating are prolonged chewing, so chewing your food until it's very, very masticated, soft, easier to swallow. Really interesting feature that there was a study where they videotaped adults with EOE eating and adults without EOE eating and compared what that looks like. And the most specific finding was pretty interesting. It was actually the number of times that the folks with EOE would eat a single bite of food, put their fork down, pick up a drink, and then go back to a bite and drink. That the more you did that, the more likely you were to have eosinophilic esophagitis. That most people when they eat, there's a pace that you're eating a
See,
few
I used
bites,
to do that.
take a drink, eating a few bites.
And because I couldn't talk this.
Other questions you
It's
can
hard for me to
ask, you know, that
swallow
are
this
more
dry
specific
foods
and more
like
leading
bread.
are things like, you know, is food getting stuck? Do you feel like things are getting hung up in your chest? Does your throat hurt when you eat? Those are oftentimes things that can be kind of revealing for, hey, this is something I should be worried about, eosinophilic esophagitis. And I think this is a really important question because one of the things we oftentimes deal with in clinic is I have the patient in front of me, but this patient has siblings, and we know that the risk is low, but not zero, that siblings will have this. And so these are the kind of things that I think I try to equip families to be able to recognize some of these symptoms in the other siblings or other family members, honestly, because that really helps us, you know, get those patients to the right care providers and diagnose if they really have it, and ultimately treat it. So that's a great question, but that's something that definitely I think there's more to come, and hopefully that's something that we'll be able to contribute to teaching people how to better recognize this earlier and get the care.
Thank you, Dr. Jacob. That was a great question and great answer. And here's another good question. Are there any concerns with repeated endoscopies?
So I think that's a really good question, and we get that a lot, and I think we question ourselves a lot about that. And you know, we talk to different anesthesiologists about this as well. There have been multiple studies that have been done in kind of like the long-term effects for anesthesia being used in children, especially in younger children. And some of them have reported some neurological deficits from that. However, most of these studies are based on prolonged use of anesthesia in patients that are sedated and intubated during long periods of time, like in the ICU setting, not so much from repeat short sessions like what our endoscopies say. So usually our endoscopies are going to include maybe like a 15-minute time of sedation. So for those kind of like short interventions, we don't have evidence that it's really going to lead to complications in the long term. However, as everything in medicine, it's kind of like a work in progress and we're constantly learning. So there may be something that we don't know yet. And for that reason is that we try to do only as many procedures or still as many procedures that we think are necessary. And we encourage everybody to make sure that every procedure is meaningful, that we make sure that when we're doing the procedure, we know that we're actually answering a question and just not doing it randomly. We always encourage our patients to make sure that when we're doing it, we're, you know, the patient has been on the right intervention, that we know we're going to check if that actually makes a difference and not just doing it to do it. So I think that, I guess the short answer for now is that as based on what we know now, there's no long-term complications from repeat short times of anesthesia as the one that we use for our EGDs. However, because this is still kind of like a learning process for everybody, as you know, we don't have that many other opportunities or other situations where we have to do so many repeated endoscopies in medicine, or so many repeated sedated procedures in medicine. I think we try to use it like very cautiously and just make sure that we do it only when necessary. And as a community, we're trying to come out with other ways to monitor the disease that are not going to include necessarily sedation. So there are other centers that are using transnasal endoscopy as a way to evaluate the status of the disease without having to use general anesthesia. And that's something that we're definitely looking forward to implement in our center in the next few years, hopefully soon. There's other, a lot of research that is being done to try to develop other non-invasive ways to follow the disease activity over time without having to do repeated endoscopy, just to make sure that we avoid the sedation. But as of now, we see it as a very safe procedure, even if we have to do it a few times per year.
Okay, thank you, Dr. Montoya. Very good. So this is a two-part question, and if Dr. Calloway, if you can hear us, this might be a great question for you. We have a attendee whose son is 19, and she's wondering if at that age she should be seeking an adult gastroenterologist, and if there is a clinic for children at EOE who are transitioning at age 19, and also if Flowdent is being used in that age group, or if that's something that can be prescribed still.
He had told me
I think we're
when
gonna
he told
get him
us
unmuted here so he can answer that question.
Just go up.
it should be a young adult,
And hit his microphone.
early 20s, early to mid
Hello.
20s.
Can y'all hear me now?
Yes.
And you can
Okay,
I
awesome.
think I let Shane say
Yeah, so
I
a
think
couple
it
of
was
things,
about
I guess
20
overall,
40
yes,
minutes.
first off, we do have clinics at UAB that see patients with eosinophilic esophagitis. Most of the general gastroenterologists will do this, and then myself, and I will kind of allude to this a little bit later on, I've primarily specialized in esophageal disease, including the disorder of EOE. With regards to the secondary question about still using topical steroids in adulthood, yes, they are very commonly used and it's still actually probably the main treatment that's used for eosinophilic esophagitis. It sounds like in pediatric as well as into adulthood as well. So it's commonly kept. We monitor patients on that and prescribe that frequently.